Bleeding and clotting time. As the name gives indication, are the kind of tests used to assess the time period within which patient's bleeding and clotting stops. Bleeding time measures how fast small blood vessels present in the skin stops bleeding. The normal time should be from 2 to 7 minutes. The procedure of bleeding time is so simple that we prick the finger lobe of a person after clearing it with an alcoholic swab and start the stopwatch. While having the blotting paper, we attach it with the person's pricked area after every 20 to 30 seconds. Stopwatch is turned off when bleeding stops and time is noted. For the assessment of clotting time, we take 2 ml of blood into non-hyperonized tube in water bath, and after every few seconds it is checked whether the clot is formed or not. Normal range is 6 to 10 minutes, and the tests are helpful to indicate the risk of coagulative disorders including hemophilia and von Willebrand disease if takes abnormal time rather than their reference ranges.